That way, for anyone who's having trouble with audio or who wasn't able to join us, we'll be able to send them the link to the recording.
Wonderful. And Jonathan, if you want to click on invite guests, you can because you are the host.
Okay, great.
You know where that is?
Invite guests. So is that in invite and refer or remind?
Yep.
Yep. Okay. Okay, excellent.
All right, so you are the host. I'm going to go mute, and you can press session record.
Okay. Yeah.
And I hope you have a wonderful day, and we'll see you at noon or 1.
Yeah. Sounds good. Okay, thanks a lot, Margaret.
Cheers.
Okay, hello, folks. So we'll get started. We've got a few people on WebEx and a few people on the phone, or a variation of both. So let me just run through the roll call just to make sure that I haven't missed anyone, because there were several people who communicated by email who don't seem to have made it in thus far. So let me just start with Heidi. Heidi, whereabouts are you from?
I'm from Borden, and I'm here on behalf of Lynn Sorrell.
Okay, excellent. That's great. And is anyone else joining you from Borden?
No, just me.
Okay. Excellent. Great. Thanks very much. And next we have Kara, who's watching us via WebEx, but on the telephone there from Halifax.
Hi, Jonathan, from Halifax.
And Marie-Claude, est-ce que vous pouvez m'entendre?
Oui, bonjour. Je suis avocate, puis je suis aussi accompagnée de Sylvie Gagnon.
Okay. Parfait. So 2 people from Valcartier. And then we have Mona Curry. Now, Mona, I believe you're from Winnipeg, is that correct? Now, she may not, I don't think she's been able to connect with the audio. But yes, apparently she can hear, she just can't talk. So if you just want to use the chat, Mona, while we're having this conversation, then I'll just keep an eye on the chat, and that way we can communicate that way. And we can always have a telephone call after the fact if, and that's open to anyone on the call or who hasn't been able to make it, if there are additional questions afterwards. Okay, so we've covered off the WebEx. Now there are a few other people on the phone. There was Donna from PEI. And then we have Tamara and Jacqueline.
Yep, we're here.
Hi, Donna from PEI.
Hi.
And so Tamara, I apologize. I didn't write down your location. Whereabouts are you from?
Trenton.
Trenton, right. Excellent. Great. I'd just like to keep track of how much participation we have across the country, because it's useful for us to see, are these useful sessions? Are people joining in? Is there some other more useful way that we can help you guys out and get feedback? And then we have Peggy from Gander.
Yes.
And that's all I have down on my list. Margaret, actually, from Greenwood.
Right on.
Yeah, excellent. Is there anyone I missed?
Hi, Margaret from Greenwood.
And good morning.
Okay.
Lovely to hear your voice.
Anyone? Okay, great. So if anyone joins us, I'll just note it down. But that's excellent. That's a small enough group that hopefully we'll be able to have a good discussion. And you'll get a chance to ask as many questions as you want, make as many comments. Basically, this session is to talk about how it went with the service delivery stats, what are the problems you ran into, the hiccups, what went well compared to the past years with e-business and stuff like that, and how can we improve it for this coming year. So my name's Jonathan. I work at Military Family Services, and my role is the lead on performance measures, even though there's several other people in Military Family Services who work on similar type projects. So I know that several of you have been in on the teleconferences over the last few years. We had teleconferences, video conferences in February, in May of last year, plus March of this past year, to talk about the mental health performance measures. So it's great that we're getting so much feedback, because that way we can actually develop a program that not only works for you and works for us, but hopefully will get as accurate and consistent stats as possible, but without grinding your business to a halt by asking you for everything under the sun. So like I said, this is a quick check-in. We'll be recording the session just for the benefit of those people who weren't able to make it in, since it is a Friday, and I realized that a lot of things hit the fan come Friday in the communities and stuff, and so yeah, I realized that not everyone's able to make it. So we'll send out the link to the recording after this, and we'll also put it on the website just to make sure that everybody's in the loop. I'm just going to run through a few slides really quickly before we get to the feedback session. I think most of you are probably familiar with this, but this is where you find the link to the Performance Measurement Tiger Team website, where I keep all of the files. I wanted to really put them in one location so you don't have to search all over the internet to find these things. So basically you just go to CFMWS and our MFS page, and then at the bottom of that is the Working Groups page. If you click on the Working Groups page, you'll come to a Performance Measurement Tiger Team button, and you click on that, and this is the page that you get to. And I just put the link at the bottom here. I can send you this presentation after, but like I said, I think the majority of you are pretty familiar with this page by now. But it's really, hopefully the stuff on there is useful for you, because it's not only shows the presentations that I've given in the past, but it also has videos of some of the virtual video conferences we've had, a checklist that we made to develop our own performance measures, including those for the MFRCs, but also those for us as MFS staff, because it would be really unfair for us to ask you guys for stats and not calculate stats on how we're doing, how we're performing, what the health of our staff is, all those kinds of things as well. So we're capturing all those, and we went through the checklist in order to determine which measures we're going to use. There's also a glossary if you're wondering about any of the language I'm using. Frequently asked questions, which I've updated several times, so it's getting pretty lengthy, and a flow chart of the process of service delivery data, so how it works in terms of us putting the ask out and you turning in your stats. And there's a few sample forms there down below as well. That's actually an old screenshot on there. There's several more files that have been added since I took that screenshot. Okay, so this is basically how if you're fairly new to this and haven't seen one of my previous presentations or seen one of the PowerPoints, this is how the performance measures came about. I won't go into great detail about this, but essentially in the Ombudsman's report, it was telling us in 2013 things that we already knew and we were already developing, but it really provided us with the impetus and also the justification to Chief of Military Personnel Command and everybody else in the military that yes, we really do need to proceed with finding out a way to gauge what kind of an impact we're having on families, how we're doing organizationally in terms of staff health, those kinds of performance measures, which are pretty standard throughout the not-for-profit industry. So that was kind of the impetus behind it. And then we had the operating plan that really implemented a number of the Ombudsman's report's recommendations, including the performance measures. After that, we had the logic model, where basically we consulted with many different participants, including from 27 locations. That includes members of the chain of command, boards of directors, MFRC staff, to try to, and the logic model is basically talking about what are the outcomes, what are we looking to achieve, what are the impacts that we want to have as an organization. So that's really where you have to focus your efforts first. We found out through studying performance measures, you really need to figure out what impact or outcome you want to have, and then start developing some of the activities and outputs and measures that you're going to do to be able to gauge how you're doing in making that impact. Then we came out with the performance measures. So we had a Tiger team of 10 MFRCs that were involved from Halifax to Comox. And in 2015, we also came out with the service delivery data based on the feedback from the Tiger team. And the idea behind this was to ask only what we absolutely need, because we knew with the previous e-business, it was so long, it was such a complicated program that really it was costing the MFRCs a huge number of hours to fill out these stats, many of which we didn't actually use. So I went through all the questions and we stripped down many of them, hundreds of them, to get down to the 51 questions that we actually needed to be able to gauge what kind of an impact we're having. So from 1,500 to 51, hopefully it'll be a lot less effort, and using fluid surveys versus e-business, hopefully that'll be an easier process for you guys as well. So I was just going to go through a few of the questions that I've had thus far, just in case they might be some of the questions that you had throughout the process and how I answered them. So one of the questions was, actually, just before I get to that, can everyone hear me okay? If you can hear me okay, give me a green check mark on WebEx. And on the telephone, does that, what I'm saying, does that make sense?
Yes. Yes.
Okay, excellent. And you guys on the telephone, are any of you currently on looking at the WebEx right now?
No.
I am, Kara.
Okay. Okay, so what I'll do, just so that you can see, I mean, there's not a whole lot to the slide. I don't like to pack my slides full of stuff because it just gets way too boring. So there's not a whole lot of data on the slides, but I will send you the slides after the fact, just so you have that to refer to. So one of the questions I got so far, and thank you, Mona, for saying that you hear me, which is great, is how do I get a printable version? So I think a lot of you figured this out. You just go into the fluid survey. A lot of people wanted to just be able to print off the fluid survey. You can go in and just put an X in the number of the boxes, and then on page 2 you just click on Word document if you want a Word version, and it'll enable you to print that out. That's one of the settings that I created in Fluid Survey because I anticipated that you guys, I know I myself, I was filling this out, I'd want to be able to have a printout copy of what I completed, but also it's sometimes useful to just have a paper copy that you use. The second question that I had was on question number 6, the average number of board members. Is this the total number of board members? And the answer to that is basically yes, the total number of board members throughout the year. I'm going to change the wording on that question just to make it a little bit clearer so that it's not so murky. And that's one of the benefits of having this, hopefully, this kind of session where you guys can tell me, you know what, this question really wasn't clear, or this definition needs to be tweaked in order for everybody to fill it out consistently. Okay. Question 3 was, sorry?
Can I ask a question about number 1?
Yes.
All right. So it was really easier to use Fluid Survey. And I had a question about, can we have a version where we can go and fill some part and then go back like days later and submit it just later?
Right. Yeah. Were you able to do that with the current version? Could you go in? And
I was too scared to try and lose my data, so I didn't try it.
Right. Okay. Because I'm pretty sure I checked off that box that allows you to go back as many times as you want to complete the survey, but I will double check on that to make sure that because I know that is an option with fluid surveys, that if I check off the right box under settings, that enables you to go in as many times as you need, because understandably there's some of the data is right at your fingertips for some of the MFRCs, whereas other data you have to get together and crunch some numbers and that kind of thing. So
Jacqueline said that no, she tried to go in and out and couldn't.
okay. All right. I will
Thank
fix
you.
that. So modify. Okay, great. So I will go into the settings and fix that so that we'll make sure that you're able to do that in the future. Were there any other questions, Marie-Claude?
Non, c'est bon, merci.
No? Okay. All right. Sorry, was there another question from someone else? Okay, so question 1B, only the members of the VAC pilot project or the sum of all family contacts. So the person was asking, do I include everybody plus the VAC pilot project? And the answer to that is that no, it's basically just the VAC pilot project members that we wanted in there. And we also had a related question, which is what is the difference between number of contacts and number of family members? The reason why we asked that is because the number of contacts shows us basically the burden of effort that you have in a particular area. So if for instance, the majority of your contacts are in the info and referral zone versus some other zone, that gives us an idea of where you spend the majority of your time. And that way we can gauge how it's going with family services, what are families most using in terms of the services. Whereas number of families is much more difficult to calculate, but gives us a sense of the overall number of families on the base wing or unit. Okay, so the number 4 was, do you have a sample system for gathering these stats? So that was a great question. We covered that question as well in the last video conference we had. When we in the Tiger team tried to develop a globalized system or Excel spreadsheet or something like that for everybody to use, it failed miserably. And the reason is because everybody gathers their stats differently. Everybody has slightly different programs and stuff. And so it became a real nightmare. And our experience with creating some sort of harmonized system like e-business is, it ends up being a cottage industry by itself. It takes up a huge amount of time and usually doesn't work for the majority of people. So, so what we thought was, okay, well, why don't we look at what the MFRCs are doing and show a few templates so that other MFRCs might be able to use them as samples. So that's why we uploaded them to the website. And one of the advantages of these teleconferences is to be able to share those experiences in terms of we tried to gather these stats, and this is the system that we came up with. And that way we can share that among the MFRCs, and you guys don't have to recreate the wheel when someone has already put in the effort to develop something that works for them. Okay, so next question. I'm just trying to run through these fairly quickly just so that we get to your questions if you have any or comments. Is there a dashboard for mental health? I wrote back to this individual that the mental health measures are actually, for the most part, on what's called the family dashboard. I'll put a link to that on the Tiger Team site, but basically we created a few dashboards. The dashboards are condensed versions, a visual version of showing a few key measures of importance to that target audience. So for the family dashboard, we tried to pick indicators that we thought families would be interested in, and mental health we thought would be one issue, not only because it often comes up over and over again with family consultations, but because it's in the media a lot. So I'll put a link.
Jonathan, where are the dashboards? Who are they accessible to?
So the MFRC dashboard is, what I'm going to do is I'm going to I've got to crunch the numbers first, and then I'll put them into the dashboards, MFRC dashboard, and put them on the performance measure Tiger Team site, just so that it's in the same location as everything else. And that way it'll be available to you guys. Now these will be the aggregate numbers, right? They won't be the individual centers numbers and that, but I'll also send you your individual centers numbers, and you already have them probably because you printed them out and you supplied them, but just to give you a sense of how you compare with kind of the national average.
Okay, so are those dashboards going to be publicly accessible?
The dashboard, the aggregate MFRC one will be on our public MFS website.
Okay.
But again, that's, I mean, if you look at the dashboard, it's basically 7 measures. So it's not only is it rolled up among all the MFRCs, but it's rolled up, some of the measures are rolled up under one larger measure. So I provided a copy of it in one of my previous presentations, but what I'm going to do, I'll just make a note to myself, is just upload an image to the, just so that you can see what it looks like, to the Tiger Team site. And it won't be complete yet because, like I said, I've yet to crunch all the numbers. but at least it'll give you an idea of what the dashboard will look like once that's completed.
Yeah, I just wanted to know whether or not I had to get messaging ready. So once the dashboard is available publicly, it's just nice for us to have some kind of response if our local areas are a little bit different than the national picture.
Absolutely. And
so I just want to make sure that I'm ready to be able to have the right messaging ready.
Yeah, and the FAQs hopefully will help a little bit with some of that messaging. But this is really the advantage of performance measures, is that it gets a conversation started, right? Where people see a number and say, that doesn't fit in with my experience, and then you can explain the difference between the local experience and the national averages, and it just helps to better inform people. And it also, frankly, I mean, it adds to the credibility as well, certainly of our organization, when we're able to say, okay, this is the number that we currently have, this is how we're measuring it. Do you have any ideas about how to improve this measure?
Yep, that's excellent.
Yeah. Okay.
Jonathan, can we know when we should have those data available?
So what I'm hoping is that I will have it within 1 month. I will have the data sent to you as well as up on the website. Because the reason why I held this teleconference or video conference so quickly on the heels of you guys submitting it is I want to, if there are any tweaks to the questions, you guys are already gathering data. So I want to try to modify the questions as soon as possible so that you know what you're supposed to be gathering. So that way I want to complete the changes to the question in the next few weeks, and I want to get the data crunched out from this past fiscal year out in the next month.
Are you going to use all the data, Jonathan? Like, are you, like, you've taken a look at it. I understand you have to crunch it.
Yep.
But are you confident that what you've received is getting at what you intended, and so are you going to use it all?
Yeah, so that's a great question. So basically, I had a look at the data under each one of the questions, and to tell you the truth, it's actually, there are only a few outliers in terms of numbers where I'm not really sure if the interpretation was the same, but for the most part, the numbers are pretty consistent with what I would expect according to the interpretation that I put in there. So I'm actually, I was pleasantly surprised, because given that this is the first year, I wasn't really sure what to expect. And so I think that a lot of the data is going to be quite usable. We may just need to tweak, like add a few explanations or examples or something like that, just to ensure consistency, and then make sure that I have a telephone conversation with a few of the centers who maybe interpreted things slightly differently to get at, okay, if you're interpreting it this way as the majority of MFRCs, what would the number be?
Because the number 1 and 2 measures are the ones, I mean, we've had the most discussion with as part of the Tiger team. We continue, and those are the ones that, I don't know. I'm not very confident that across the country we've all done our best to interpret it in the way that we understand, but I don't think that we're getting numbers that are real numbers that you can do stuff with in terms of benchmarking or to really tell the story, because I think there's huge issues with 1 and 2 in terms of collection.
Agreed. And I think you're right. That's probably the area that is going to be the most difficult to get accurate numbers on. So that's part of the reason why we're discussing it today, to hopefully make that more precise. But to tell you the truth, I think that it's always going to be a bit of a nebulous area. So in terms of number of contacts and number of family members. Until we have a system that's actually electronic, where every time a family comes to access services, they're tagged in some way. So it's what we're hoping is for the best possible, given the tools that we currently have and given the system that we're currently working within, the best possible idea of what the number of contacts is, what the burden of effort is between the 3 different areas there, and the number of family members. Acknowledging the fact that, you know what, there's going to be some duplication between categories, and some of the number of family members is more of a guesstimate than it is a really precise number.
Jonathan, what you're saying is really interesting, and I was wondering if those questions that you are targeting that are quite a good comparison nationally, are we going to discuss that today?
Sure, we can discuss that today if we have time, and if we don't have time, we can always set up another teleconference or video conference to discuss as well.
Yeah, that would be interesting for my point of view anyway.
For sure,
Thank
absolutely.
You.
Okay, so the another person asked about what's the guide that you keep referring to. That's just the last few pages. When you go to the website, you'll see the annual service delivery documents there that many of you have clicked on. And I'm talking about the Tiger Team website now. The guide is the last few pages of that document. I wanted to put the guide along with the questions just so that you'd only have to download one document and you'd be able to see, okay, what's he talking about in terms of the definition of number 1, 2, 3, that kind of thing. So when I talk about the guide, it's just the end of that document there. What are some examples of mental health services that fall into the subcategories in the latter questions of the service delivery document? And some examples are available in the guide. So actually at the last part of that PDF that you can download from the Tiger Team website. Okay, are the flows included in the reporting? Yes, the family liaison officers are included. They've been rolled into the MFRC service delivery data to hopefully make it easier for you so that you don't have to go to multiple sites to enter different kinds of stats. So it's on the 5th page of the annual service delivery document. The flow is actually mentioned under intervention. And so the flow stats are rolled into a number of the questions, like question 1, I've got questions 1, 2, 5, 9, and 13 actually include some flow stats. Okay, so what's included in the staff hours dedicated to programming. So that includes, like I said in the guide, and please let me know if that language is not clear. It includes all the hours spent with program planning, program delivery, and program evaluation, because that's still an integral part of programming. So you can always check on page 3 of the guide for more details about what that includes.
I don't think the definition necessarily was the tricky part. The tricky part was the number of staff and really being able to measure that without, yeah. Okay. So that is a place where we certainly sat down and looked at TORs and looked at the amount of time, and did some estimating, but we certainly did not do whatever that analysis is called, where people keep track of every, intervals of time for a week or anything like that. We didn't do that type of analysis. That is a tricky one that I don't know how other people handled that one, but you're getting an estimate there.
Yeah. Is there any way that that I could make that more precise, or we could make it easier to calculate or answer?
I don't know, other than doing the actual analysis of, of time, which that's a huge task to do.
Yeah. Yeah. How about anyone else have difficulty with that one, or have some comments about how to improve it?
Well, what we've done for MFRC is that we've tracked when a staff member were doing a volunteer committee doing some programming, so to end up into programming. So we were counting those hours, like sitting on a working committee, and like different specific activity with the volunteers. We're tracking those hours spent, and we've added the full-time staff dedicated to the volunteer program to those hours. So we end up to 1.5 positions.
Okay, so you're able to track that. Do you just use a spreadsheet, or?
Well, we've had a line under our regular stats. So if someone, like say in a youth center, they usually have volunteer activities, and then under that line we've said hour. So if there was 2 staff present at the volunteer activity for the youth event, then there was adding 2 hours there. So at the end of the year, we've added those hours.
Okay.
How did you collect your staff hours for programming, Marie-Claude?
We're under number 9, so it's programming for volunteer program.
Number 8, how did you do that one?
For 8?
The staff hours dedicated to programming.
So number 8. No, go ahead. It's basically what we're doing in the financial reporting previous year. So we have something within our finance to say who's paid with the program, the MFS, and then we took those hours. Exactly. That's what we were doing before.
So if they were a full-time programmer, you counted that as all those hours. You didn't look at you didn't take away time that they might have been working on admin tasks or other things. You considered if it was a programming full-time position, you counted all of their hours.
For number 8, yes.
Yeah.
So if somebody was doing...
I tried to estimate when the amount of time that they would have done admin and other tasks other than programming, Jonathan. So like that's a good example. I don't know how everybody else figured that one out,
yeah.
But I'm not sure what numbers you're getting.
Right. Yeah.
It's a proportion of what if somebody is doing a part of administration and a part of the programming, we evaluate the percentage of each of them, and we're just divided the hours for the program and the administration. It was like that before.
Right. Yeah, so if you have, if you estimate that they spend about 10% of their time on administrative tasks, you just take off that 10%?
Exactly.
Okay. Okay.
It's the only way we could do that, because we cannot take every hours to be sure. It would have been too hard for everybody,
Yeah.
Yeah, agreed, Sylvie. Yeah, we had to estimate what that looked like.
Yeah.
Whether you look at that for a week and you look at what that is and then you do your numbers. Yeah, but it's an estimation.
Mm-hmm. Yeah.
And
I feel good when you're doing it. I'll just say that because I'd like to give you really straight answers. So that's just the confidence in some of these numbers is that we did our best, but that it looks different across the country. So how did those numbers get to be compared if we've interpreted it differently is what's the value. That's the tricky part.
Yeah. But remember when I was on the financing working group, it was decided like that we just take off the administration part and that everybody else was programming in a way. So usually it's normal to do that way, because in the working group when we report about financing, that is the way it was choose to do the thing. So
But are we using that? I guess, Jonathan, that's the question I have. Are we using that one? So the example of it's the administrative definition by MFS and how it's the funding piece, or is it I'm looking at that adult and community engagement position, and they are paid. They're an MFS employee. They are paid for 100%. That's programming that they do. None of that money is in admin, but we know that they do programming 3/4 of the time, and the other quarter is going to meetings or doing administrative tasks, which I read in your definition. So we're only counting 3/4 of their hours towards programming.
Mm-hmm.
Those are two different, rather than I have a position that's split and they do adult programs half the time and they do finance or something the other half, and then I'm only counting, like those are two different ways of approaching that question.
Right, yeah. So how could I make that more clear?
Well, the split with the specific admin, say you've got somebody doing programming half the time and finance half the time, that one's pretty clear.
Yeah.
Well, that would be easy, yes, but that's not the reality. Yeah.
Sure. Any of the administrative tasks associated with program planning is still considered programming, as far as I can see. If it's required as administrative support for the programming, then it would stay within those hours associated with programming. It just seems to make sense to split it out that way. You can't do program planning or deliver programs without some level of administrative effort alongside it.
Do you agree with when you look in the description under the guidance document in terms of how admin is described in there? Do you agree that that's pure administration, or would you have included those tasks as well?
I don't know about the definition, but I would say that what we just talked about in the working group, in the financing working group, it was this, you know, everything that's admin in the program, it's still in the program. So the time it doesn't have to be taken up because it's administration for the program.
And that's what it says in the guidelines.
Yeah. So I'll just, how about this? What I'm going to do, given that it sounds like people are pretty comfortable with what's in the funding, what was developed by the funding working group. So what I can do is just make sure that the definition that I'm putting in the guidance document harmonizes with what's in the funding working guide and all those related documents. And that way we'll have consistency, and hopefully if there is, after that, if there is some discrepancy, then we can modify the definition amongst all those documents.
And then do you need to ask the question then, Jonathan? Because then you're getting that information already in the funding document. Right.
So, and that was one thing that Louise and I tried to break up all of the information. I would capture all the information that she's not capturing, but that we still need. So apparently we didn't. There are still a few questions where there's a bit of an overlap there. So this is one where I'm going to ask her whether or not we're actually capturing that data with her document, and I can take it out altogether.
Because our hours, if we followed that, would be higher than what we submitted.
Right.
Because we did look at the definition and said, okay, if they went to a worker, if they went to a work health and safety meeting,
yep,
that wasn't time that they were programming, so that came off of the time.
Right. Okay. So put a note to myself to check in with Louise on that, and to make sure that all the definitions are the same in terms of what is admin and what is not, and that way we'll have consistency on that one. So that's great. Thank you for that. Okay. So oh yeah, we had. Sorry.
I have a question.
Yes.
You know, for us, we did put in the report only the part that was financing by MFS.
Right.
We didn't put the part that was financing by others, even if it was for the programming. And right, it was kind of, you know, was it okay?
Yes.
Okay.
Yeah. It's for, because this is to give us an idea of how much of an impact the MFS funding is having. So we can't take, we can't look at stats that really we didn't have anything to do with because we didn't fund those programs.
Yeah, but you know, in a way, for the numbers in each section,
yeah,
you still have the number. You know, we don't give you the hour, the staff hours, all of it, yeah, but we're giving you the numbers, and the numbers are accomplished because we have more financing from other source. Right. So, you know, just to be clear, the numbers, except for that part, include all the services, even if it's not MFS who did pay for it.
Right.
The other categories. Oh, okay.
Yeah. So maybe yeah, maybe it'll be a matter of what if I was to make it more explicit in the question that this is only related to MFS funding? Is that going to be possible for you guys to calculate? Or no?
If we're going to, are you at, like, there's no way for, well, I don't know, but family contacts and family served to pick that apart and give you numbers of the families we serve that with MFS funding, and no way.
Yeah.
But you know, the thing is, the awkward part is we're giving all the numbers for the services, but it looks like we're able to do that without I don't know, 35% of the financing part and the hour part. So it looks like we were doing better for less than what is in reality, because we couldn't do that with only the MFS hours for the people, you know.
Yeah, when I looked at the other sources of funding documents, the stats that you guys sent in, I was really surprised and at how much other funding you get from it, or many MFRCs get from other sources, which is clearly required for the service to families. So, so yeah, I think that we can't look at these stats separating it from the fact that we are not the sole funder for these organizations or these outcomes. So I think that in my first belief when I put out the questionnaire about other sources of funding was that when I present these performance measures, I'm also going to have to say, now, listen, the average MFRC gets this percentage of funding from other sources. So you can't take sole credit for these numbers. And as was mentioned, I think it was Kara who was mentioning there being a way to sort of tease it apart with contacts and number of family members. Is that right?
Yes, there's no way that we would be able to, be able to tell you, is that from MFS funding? Like, I'm sure we could, but it would take a couple of us to figure out all these stats to give you at the end of the year.
Yeah, exactly. So
that's not what we're doing with our funds.
And there's always going to be a little bit of discrepancy here. So I think probably our best case scenario is to ask the questions sort of explicitly as possible, but also whenever I present these, you can't present stats without context, because that would be completely defeating the purpose of actually gathering the stats. So whenever I present these, it'll have to be in the context of, well, you know what, these MFRCs are also getting funding from these other sources to this extent in order to achieve these outcomes. Does that sound okay?
Mm-hmm.
That makes sense? Okay. Okay, so the mental health stats questions, there were a few questions in terms of, you know, if you're seeing a couple, do they count as one client or two? I said they count as two clients because they're two clients. If you're seeing a child, do you count meetings with their parents as separate clients? I said yes, because they're separate clients, their parents count as separate from the children. And these are the sort of things that I'll probably provide as examples in the upcoming version of the guidance document, just to make it absolutely clear. For the total clients in a given month, should this reflect only clients who had sessions that month, or does it reflect all open files? So I just said the total number of clients should be those who had sessions as well as those who were open at the time. And that's why we ask for number of new cases opened for the social workers and other clinicians, so that we can see what percentage of the what percentage of the cases are new cases, as opposed to those that are already open. So again, that's stuff that I'll include in this upcoming version of the guidance document, just to make it absolutely clear. In terms of some people were asking, where should I put additional info? There's really contextual info that you should know about. You just put that in the dialog box after the question, and you guys made great use of that. Actually, I was looking at a number of the comments, and it's really helpful to put the stats into context, so that then whenever you have questions, whether or not it's questions from your board, or if we have questions from that, you can provide that context, the contextual piece that's really necessary for us to know. Other sources of funding, where the definitions, those can be found in the funding guide. There was actually a link right in the fluid survey, but I think I'll probably just put a link to the funding guide under the performance measures website as well. So a note to myself to do that. And does MFS public funds include the Veterans Pilot project funds? And for those individuals who asked that, I said no. The Veterans Pilot project funds are being tallied by Louise Haig under a separate account. I think that she's probably asked for that in a separate email. So my questions for you So we're at 10:50. But like I said, we can, if we run out of time, we can always set up another time, or you can email me or call me if you think it's more of a one-on-one conversation. But these are just basically question prompts, so feel free to jump in on any of them at any time, or other questions that you might have. So how did it go gathering the data? Where were the hiccups? And you've mentioned a few of them. How did it go using fluid survey? We had a few comments about that. Were there questions that you were worried about that might be calculated or interpreted differently? We discussed a few of those. Any suggestions for improvement for the process this year, or tips and tricks for gathering data that you wanted to share with other MFRCs? So let's just open up the floor, and you guys can, and Mona, feel free to insert in the chat box if you have any questions or comments. Any particular hiccups or issues that you guys had with filling out, or things that you liked that we should do more of?
I found one hiccup from my experience. Some of like the guidance document that I had was older.
Okay.
So some of the questions I had to, and that's why I know for a fact you can't save and then go back to the document in fluid survey, because I had to go back and find more numbers.
Okay.
Because my guidance, like some of my documentation that I was basing where I was collecting numbers was out of date. Okay. And it could have just been that I, came late to the party and someone just handed me an old copy of the guidance, but I think some of our documentation isn't consistent with what's the newest out there. So I think next year having some prompts email prompts saying this is the new guidance, this is the new definitions based on last year's would be helpful.
Yeah, okay, great. So what I'll do is, that's a great idea, having an email. So at the bottom of my email, I'll just provide a link, a direct link to, here's the new guidance documents, here's the new definitions, here's the FAQs and stuff.
Yeah.
Okay, excellent.
Oh, because we can't guarantee that next year the same staff are going to be the ones that actually submit information, right?
Absolutely, yeah. Any other folks? Yeah.
Maybe you should put on the guide the latest date of update, because we have all version and we don't know if it's the latest one. So if you send the link and we see that the latest was 26 and our paper version is okay, we're not going to print it again.
Right. Okay, excellent. Yep, so I'll make sure I do that.
I know I've mentioned it before, Jonathan. The 1 and 2, though, I still struggle with how you're going to present that or compare that or show that, or I don't know. And I know for also one of the questions that was newer when on one of the new versions, is if you have included military members in the total number of family members, please note approximately what percentage of 2A is military members.
Yep.
No, there's no way we don't keep that record.
Right.
I don't feel that that's something that we can start doing. Mm-hmm. So yeah, I don't know that data, what you do with that and how you show that across the country and how people collected that and the meaning. So I appreciate the honesty and that you shared with the data that we used to give you and how it wasn't used and how you understood, how much effort went into numbers that weren't useful.
Yeah.
Number 1 and 2 still felt like that exercise.
Yeah.
So certainly we have how we came up with those numbers, but the value to look at those across the country, I don't know.
Yeah, yeah. And I think honestly, I don't know if we're ever going to develop a better system for gathering that data. So it may be that I'll just have to start the conversation whenever somebody asks for that kind of data. I'll just have to start the conversation with, we have no way of accurately gathering that data. and this is why. Now, this is the inaccurate guesstimate that we have, but because really, I mean, unless we front end the conversation like that, people take stats as stats, and then they take them as sort of written in stone. So I think it's important because honestly, I think that people are still going to be asking for this data in terms of number of contacts and where are we spending the majority of our effort. Is it in info and referral, or is it more in some of the other categories and stuff? And so since they're already going to be asking for that, I think I'll just have to get used to kind of being a broken record about saying that there's no real way of gathering accurate stats at this point. This is our best guess right now.
You have done so, and we have in responding to particular areas. So we're able to answer education and employment and childcare and mental health. So there are categories that we are giving you information that absolutely I feel confident that you can look at those, and you'd be able to look at those across the country. But when you're bringing those all together expecting unique users, that's challenging. And the categories that we're collecting, it's the first time that I heard you why we're collecting in those categories. Those categories are still somewhat like, I know those are the newer version of performance of parameters of practice, which I don't know where that is in terms of being out there, but those are still relatively new categories for us to place things in as well. So just a comment that I don't know if other MFRCs have done that transition or they think about it, but we still look at the old parameters of practice as how we've kind of divided things. So yes, I slotted them into according to the definitions you have there, but I don't know if other MFRCs are looking at their work in those three categories like that.
Yeah, and I knew that would be a struggle because it was really a question: do we go with the old parameters that's currently being used out there, and then just have to change it for this coming year when the new parameters is coming out, or do we go with the new parameters and provide the definition? So we decided to just go with the new parameters, realizing that these are new categories for everyone, and that we probably need to provide much more explanation behind them. But yeah, it's always going to be, I think, a bit of a work in progress. I'd like to this coming year as well have another one of these to see how year 2 went. Because I think we're always going to need to tweak these things from year to year to figure out, okay, once the new parameters comes out, how will that impact your interpretation of some of these questions? Just to make sure that we're doing our due diligence and not just gathering numbers for a check in the box, right? That we're actually getting data that's useful.
And every time we get a new parameter or a new definition, having one of these conversations may be helpful. I wasn't at Cornwall last year when it came out, but my colleagues brought it back to me and said, this is the new definitions, and I immediately started working on getting our data collection set up so everything would start falling underneath it. So the more warning we have, I think the better we'll get at, backtracking from back to April. So I had to backtrack from October to April to get the numbers, to make sure our numbers were accurate.
For sure, And thank you very much for doing that.
It was Trenton has a case management database that we're slowly implementing across our MFRC. So some of this was easy and some of it was not.
Okay. Because
we have a tracking system that we're implementing that will get us some of these numbers.
Right.
Quite frankly, we need a system like Good Life has, where everybody gets those lovely little scanning barcode cards, and every time they come into an MFRC, they scan them.
I know. That would be the ideal, right? Because that would give you a whole pile of useful data in terms of the time and types of activities that people are accessing and stuff. But I think based on what I've heard about the CF1 card or something like that, we're still many years out from a solution like that, unfortunately. So we're now at 10:59. Were there any, and like I said, if there are other questions that you want to discuss, I'm happy to set up either the other teleconference, discuss some other time, whatever works well for you guys. But were there any last questions before we wrap up?
There's one thing, Jonathan, for us that was important and that we felt that it was missing in that data report was the volunteer hours. for us it's really important, and it was put in like in the comments box. But I think as nationally, I think it's really important to show what the volunteers hour can mean, and I think it could be a nice addition into an easy data to collect as well and to compare.
Right, yeah. The reason why we took volunteer hours out is because a number of the MFRCs, when we were going through sort of trials and how would this work at the local level, a number of the MFRCs were having difficulty calculating that because the volunteer hours were spread amongst a bunch of different staff and a bunch of different programs in that. So what we did was we looked at, okay, what are, for each one of these measures actually, we looked at what are the industry best practices in terms of what's the way that we can actually measure this. And one way was through volunteer hours. That's used by a number of agencies, like you mentioned. But there was also the comparison of volunteer to staff time, which is used by a number of other agencies. So we decided to go with volunteer to staff time because that seemed to be easier for folks. But for those people online or on the phone, any other experiences with that particular question and volunteer hours versus FTE?
I think that as organizations, we probably should be capturing our total volunteer hours. So instead of changing the stat collection, maybe helping the MFRCs that maybe not be able to track those total hours to be able to do that, because I think it's an important statistic even locally to take a look at year-on-year changes and the actual value, the total value that our volunteers are bringing in, and you can't really capture that with a staff to volunteer hour ratio.
Right.
I'd feel more confident in the straight volunteer hours. We collect it, we'd be able to give that to you. With the ratio of volunteers to yes, we have a full-time volunteer coordinator, we're lucky, and then it's trying to figure out though all the other staff that work with volunteers, how many hours did they support volunteers, and how does that equal up into hours to an equivalent position? That is an estimation. I can definitely give you though a solid volunteer hour at the end of the year.
Okay. All right.
I think that the total hours is more meaningful too, and then we also can be in a position to help the other MFRCs figure out ways that they can collect those total hours.
Okay, excellent. Okay, so yeah, if we're having a particular struggle around that, maybe we can even have like a teleconference specifically on that question, on how to troubleshoot or something. Okay, cool, excellent. So yeah, I mean, it seems sort of from the consensus here that that volunteer hours is probably the way to go, given that it's another industry standard, but you guys feel it'll be more precise as well as it'll be more meaningful for you as an organization as well as for the other people who might be presenting these stats to. So I'll make that change and make sure that I put a description in there to try to make it as easy as possible to gather that number. Were there any other last questions before we close up? Okay. All right. Well, if you do run into any other questions, we've got another session this afternoon. Or, like I said, just give me a call, send me an email, and we'll set up a time to discuss. But I really appreciate you taking the full hour to discuss these with me and with each other. And look forward to some new descriptions and some tweaks based on your feedback there. I've made pretty careful notes, so hopefully I should be able to get to those in the next week or so and send you out a draft in the next few weeks. So thanks very much, everyone. And like I said, the session is recorded. I'll send around that link after the fact as well and upload it to the website. Have a great rest of the day.
Thanks, Jonathan.
Happy weekend.
Happy weekend. Bye.